AAMG. Your choice, your health, our mission.
Okay, the science of obesity. This is part 2. How can I lose weight effectively? So there's some facts on obesity. The prevalence of obesity was 42.4% in 2017 to 2018. Severe obesity was 9.2%. Obesity-related conditions include heart disease, stroke, diabetes, and certain types of cancer. The estimated annual medical cost of obesity in the US was $147 billion. That's in 2008 US dollars. The medical cost of people who have obesity was $1,429 higher than those of normal weight. Who gets obesity? It's the non-Hispanic Blacks at 49.6%, followed by Hispanics at 44.8%, non-Hispanic whites at 42.2%, and Asians lastly at 17.4%. How do we measure obesity? We use the body mass index, which is your person's weight in kilograms divided by the square of the height in meters. So if you are overweight, your BMI for an Asian is between 23 and 26.9. For a non-Asian, it's 25 to 29.9. If you are obese, for an Asian, your BMI is over 27, and for a non-Asian, it's 30 and above. The reason why there is a difference is because the Asians' body frames are usually smaller than a non-Asian. Diet in and managing obesity. So if you reduce your weight by 5 to 10%, you can reduce your risk of diabetes, hyperpressure, and dyslipidemia. In order for any diet to work, your energy balance must be negative. So the amount of calories that you take in must be less than the number of calories that you burn. An effective diet is any diet that you can stick to. You can lose 1 to 2 pounds per week if you eat 500 to 1,000 fewer calories per day. A low-calorie diet is usually 800 to 1,500 calories per day. A typical diet for a female is 2,000 calories per day. For a male, it's 2,500 calories. Weight loss is curvilinear. So what that means is initially weight loss is rapid, and then it slows down until it reaches a plateau. And the reason for this is that your body senses weight loss and compensatory mechanisms are initiated. It's called metabolic adaptation. We talked about this in the first talk. So the effect of that is you will increase your appetite, you will decrease your satiety, you will lower your resting metabolic rate, and as a result, your weight will go back up. Very low calorie diets. These are diets that are 200 to 800 calories per day. You do have greater short-term weight loss, so 16.1% versus 9.7% on a low-calorie diet, but this is very difficult to maintain. And just to give you an example, we have Oprah Winfrey on the left. In 1988, before she went on this diet, she was 212 pounds. She then went on this Optifast, very low-calorie diet. It's basically a liquid diet. So she only consumed 400 calories per day. And in 2 months' time, she was able to drop 67 pounds. And you can see she brought a cart full of 67 pounds of fat onto the stage. But unfortunately, she was unable to maintain this diet, and her weight went back up. And then in 2018, she followed a healthy diet. She got a trainer, and she exercised, and now she is at 185 pounds. Diet and weight loss. There is no significant difference between a low-fat diet and a low-carb diet in the amount of weight loss at 6 and 12 months. So whichever diet you prefer, you can use or follow that type of diet. Dieting can lose 5% of your initial weight over the first 6 months, but the weight returns to baseline over 2 to 3 years. High protein, low glycemic index diets may promote better long-term weight maintenance. And the reason is that protein makes you full more than fats and carbohydrates. There are different diets out there. Just to mention beverages, the sugar of high fructose corn syrup in beverages provides extra energy with reduced satiety, so you don't feel full as quickly, thus increasing your total energy intake. Volumetric diet reduces your energy density by substituting foods with a higher water content. So this type of diet is higher in fruits and vegetables. A high protein diet where 25% of your calories are protein is better at reducing your body weight, fat mass, and triglycerides, and less of a decrease in fat-free mass. And that is because protein does make you fuller than carbs or fat. Mediterranean-style diets have enhanced consumption of olive oil, nuts, whole grains, fruits, and vegetables. It may cause greater weight loss in diabetics than low-fat diet and also more waist circumference reduction. There are commercial programs for weight loss. Weight Watchers, you get a 2.6% greater weight loss than controls after 12 months. Journey Care gets 4.9% after 12 months. Nutrisystem, 3.8% at 3 months. And Medifast, Optifast, which are these very low-calorie liquid diets that Oprah tried, 4% greater short-term weight loss up to 6 months. But again, remember, these are very, very difficult to maintain. Another way of losing weight is called intermittent fasting. So humans have a physiologic adaptation to fasting. It involves making stored body fat more accessible as an energy source. And these pathways improve glucose regulation, they increase stress resistance, and they suppress inflammation. There are several methods of intermittent fasting. There's the complete alternate day fasting. So you have your regular diet for one day. The next day you completely fast. You don't eat anything. You can drink water, coffee, or tea. The third day you eat a regular type of diet. The fourth day, again, you do not eat anything at all. You can drink your water, coffee, or tea. Fifth day, normal diet. Sixth day, fasting, etc., etc. There's also the modified fasting 5-2, which means that 5 days of the week you're eating a normal, healthy diet. 2 days out of the week, you're cutting back on your calories to 20 to 25% of your needs. There's also time-restricted feeding, which is probably the easiest one to follow. You basically fast for 14 to 16 hours per day. Intermittent fasting. So it's based on circadian biology. So we have a circadian clock that ensures that physiological processes are performed at optimal times. For example, insulin sensitivity decreases throughout the day, growth hormone increases at night, gastric emptying and blood flow are greater during the day than at nighttime. So generally speaking, intermittent fasting will make you eat fewer meals because there's less time available to eat. Intermittent fasting also enhances hormone function, which then facilitates weight loss. There is a preference to using fat for energy instead of glucose. Short-term fasting actually increases your metabolic rate by 3.6 to 14%, and that helps you burn even more calories. According to a 2014 review of the scientific literature, intermittent fasting can cause a weight loss of 3 to 8% over 3 to 24 weeks, including 4 to 7% of the waist circumference. And that is the belly fat that's linked to diabetes, dyslipidemia, and heart disease. Intermittent fasting also causes less muscle loss than continuous calorie restriction. The effect of physical activity. High levels of physical activity decreases the risk of short and long-term weight regain after weight loss. Exercise results in the preferential loss of body fat and maintenance of fat-free mass compared to diet-induced weight loss. So remember, when you're dieting, you will lose both muscle and fat. But in exercise, as a weight loss method, you will preferentially lose fat instead of muscle. So during exercise, fat tissue metabolizes fat to free fatty acids, which provide fuel for muscles. Over time, fat tissue decreases in size and improves metabolism. Exercise also affects adipokine, which is a type of hormone released from fat, which may decrease inflammation and improve insulin sensitivity. To maintain your weight loss, you will probably need to do approximately 80 minutes of moderate physical activity or 35 minutes of vigorous activity. So moderate activity would be like walking 4 miles an hour, mowing the lawn, cycling at a light speed, or recreational badminton. Vigorous exercise would be like hiking, jogging at 6 miles per hour, shoveling snow, bicycling fast, playing basketball, playing soccer. So there's two types of exercise. There's aerobic and anaerobic exercise. So aerobic exercise is walking, biking, running. It means you're moving your body, you're breathing faster, you're increasing your blood flow. It's a level of activity that you can maintain for an extended period of time. So those people who participate in marathons, they're using aerobic exercise. Anaerobic exercise like sprinting or weightlifting is short, intense activity that has you working to the maximum, but it cannot be sustained for long. So weightlifting, for example, you cannot do that for hours at a time. So which is better for weight loss? Better for weight loss. There's both aerobic and anaerobic exercise have benefits, and both are needed to improve your fitness and health. But if you want to shed fat, then anaerobic exercise is the way to go. So in aerobic or with oxygen exercise, your muscles have enough oxygen to produce the energy needed to perform. Anaerobic, which is without oxygen, exercise means that oxygen demand is greater than oxygen supply, and you can't keep up with the energy your body is demanding. This leads to lactate production and eventually the cessation of exercise. So if you exercise a lot and you build up lactic acid in your muscles, you will actually feel very sore and your muscles will be very tired. Aerobic exercise or steady state cardio is performed at a steady, low to moderate pace. This type of exercise is great for cardiovascular conditioning and also improving muscular endurance. So these two tables sort of illustrate the differences between aerobic exercise and anaerobic exercise. So on the left, aerobic exercise, you can see it mainly affects the heart. So the heart is a muscle, and if you exercise it on and on, you will affect its resting heart rate, so it goes down. The stroke volume, which is the amount of blood that each heartbeat pumps to the rest of the body, that will go up, and the maximum oxygen consumption will also go up. Now, compared to anaerobic exercise, you can see it mainly affects the muscles. So the muscle strength and the muscle mass goes up, and the neural drive, which is nerve sensing muscle fatigue, that goes up as well. High intensity interval training. So again, aerobic exercise uses oxygen to fuel the muscles. Anaerobic exercise uses energy stores in the muscle, which then get bigger in size and strength over time. Anaerobic exercise is performed in the form of high intensity interval training. It's also called HIIT. So you rotate high intensity intervals with recovery intervals. And just to give you an example, a HIIT program would be maybe 30 minutes long, and you would do like sprinting for 30 seconds, and you would walk for 15 to 20 seconds. Then you would do jumping jacks for 30 seconds, walk for 15, 20 seconds. You do jump squats for 30 seconds, and then you would walk for 15, 20 seconds, burpees for 30 seconds, and then walk for 20 seconds, and so on until the 30 minutes or whatever time period is up. And so HIIT is beneficial for several reasons. First, you get an intense workout in a fraction of the time. You'll exhaust your muscles and burn more calories than you would in the same amount of time doing steady state cardio. So for example, if you have a treadmill, cardio would be jogging at the same pace for 30 minutes. Maybe you jog at 4 miles per hour, for example. A HIIT session in that 30-minute period of time, you would sprint for 30 seconds, then walk for 20 to 30 seconds, sprint again for 30 seconds, walk for 20 to 30 seconds, do that same pattern over and over again until 30 minutes is up. And then the HIIT session, you will burn more calories than if you were just jogging at the same pace the whole time. Thirdly, you'll also build muscle and increase your metabolism. Fourth, you're going to experience the afterburn effect. It's technically called the excess post-exercise oxygen consumption, or EPOC. So EPOC is the amount of oxygen required to return the body to its resting state. HIIT sessions stimulate a higher EPOC because you're consuming more oxygen during them, which creates a larger deficit to replace post-workout. This means you'll continue to burn calories even after your HIIT session is over. Okay, there are medications to manage obesity. There are 5 drugs approved by the FDA. The second one, Belvic, is unfortunately no longer available. There may be a risk of cancer, so it has been withdrawn from the market. The first one inhibits the the pancreatic lipase, which helps in digesting and absorption of fat. The third one and the fourth one affects the hypothalamus, which is in the brain. So it reduces food intake, decreases your appetite, and makes you full faster. The fifth one is a daily injection, and it delays gastric emptying, so it makes you full sooner. All of these drugs are not covered by your insurance company, and they can be quite expensive. There are non-invasive procedures to get rid of fat. There's one called CoolSculpting, which I do offer in my office. SculpSure is the competitor. Both only eliminate fat in the subcutaneous layer. So that is the fat between the muscle and the skin. It does not target the visceral fat, which is the belly fat deep beneath the muscle. Both do not cause significant weight loss, maybe 1 to 2 pounds. It's only a cosmetic improvement to the body. And so there is no effect on diseases associated with obesity, such as diabetes, hyperpressure, dyslipidemia, sleep apnea, and fatty liver disease. CoolSculpting, which is cryolipolysis, is a non-invasive procedure that freezes and kills fat cells. So you have an applicator, which is like a giant vacuum hose. It applies suction to the area you want to target. It then applies cooling plates to bring the fat cells down to a temperature that irreversibly damages them. Now that's about 39 to 41 degrees Fahrenheit. For most areas, the process takes about 35 minutes. After the deep freeze damage to the fat cells, they eventually die and are eliminated by the body in about 3 months. The cost can be quite high, at least $700 and up to $5,000. So when you lose weight by going to the gym or eating healthier, your fat cells shrink. And when you gain weight, they expand. Either way, you maintain the same number. But with CoolSculpting, the fat cells are actually eliminated, which is permanent, unless, of course, you gain weight, in which case the cells may multiply and swell up. One of the biggest perks associated with this procedure is that there's no downtime. So you can go to work, you can go to a restaurant, you can exercise. There's no downtime at all. The risks are minimal. You'll expect some light bruising, swelling, or soreness afterwards. Here are some pictures of someone who underwent the CoolSculpting procedure. So before, you can see there is some fat in the subcutaneous layer, and this person probably used at least 3 applicators on her abdomen. And 8 weeks later, you can see much noticeable improvement. And then this lady did the same thing again. So she had another 3 applicators at least put on her abdomen. And you can see here, 9 weeks after the second session, she basically has a flat stomach. SculpSure uses heat instead of cold to kill the fat cells by lasers. Applicators are placed over the treatment area. The laser is used to heat the fat up to about 107 degrees in the treatment area. The damaged and killed fat cells are eliminated by the body's lymphatic system. It's FDA approved to treat the stomach, love handles, back, thighs, and double chin. Most treatments take 25 minutes. And again, you may need more than 1 applicator per treatment area. Like CoolSculpting, there's no downtime and the risks are minimal. You might expect some light bruising, swelling, and soreness afterwards. And like CoolSculpting, the fat cells are permanently eliminated, which is a lasting change, unless, of course, you gain weight. Surgery. 2 types, there's liposuction and bariatric surgery. So liposuction is suction-assisted lipectomy, is a cosmetic or aesthetic procedure. The surgeons remove and contour your subcutaneous fat by aspiration after injecting salt water. It does not affect your visceral fat, which is the belly fat deep behind or below the muscle. It can remove up to 4 liters of aspirate injected into the fat beneath the skin. You are able to lose 5 to 7% of your body fat, but because it doesn't target the deep belly fat, there is no influence on risk factors related to being overweight. For example, insulin resistance, blood pressure, lipids, cytokines, which are these hormones released by fat cells. Bariatric surgery, however, does target the belly fat. So it is for patients with a BMI of over 35 with related obesity comorbidities, or a BMI over 40, and both of them, you have to fail medical treatment for sustained weight loss. There are 2 types of bariatric surgery. Number one is a malabsorptive type of surgery like Roux-en-Y. The second is a restrictive, for example, the gastric band or the sleeve gastrectomy. So Roux-en-Y gastric bypass is the second most common procedure at 23.1%. Typically, you will lose 25% of your weight up to 45%, and you keep it off. A small gastric pouch is created, which is about 1 to 2 ounces in size. A normal stomach is the size of your fist and can expand to store up to, at least 1 liter of food. So the rest of the stomach is disconnected, and food enters a small stomach pouch, and then it goes directly into the jejunum, which is the second part of the small intestine. It bypasses the first part of the small intestine. So because of the malabsorption, you can have multiple nutrient deficiencies such as iron, calcium, folate, vitamin D, B12. There's also something called the dumping syndrome because the food enters in here, it doesn't have time to wait. It just goes directly into the small intestine, and so you can get some side effects from that. Then there's the adjustable gastric band. So you have a constriction of the upper stomach using a mechanical device encircling the stomach. It makes the upper stomach into a 30 to 60 cc area, and the band can be adjusted from the outside. It's a third most common procedure at 5.7%. Typically, you lose 10 to 15% of your weight, but there are poor long-term results, 2% per year, such as erosion of the gastric wall because of this band, or herniation, which is part of this lower part of the stomach goes back up into the upper stomach. Sleeve gastrectomy. The stomach is cut and sewn into a caliber of a finger. So 75 to 80% of the stomach is removed. It's the most common procedure at 53.8%. You can lose 15 to 20% of your weight. You will get an acceleration of gastric emptying just because 75 to 80% of your stomach has been removed. There has been improvement, even resolution for a lot of obesity diseases, such as diabetes, 78%, high blood pressure, 68%, and dyslipidemia, 66%. Outcomes of bariatric surgery. There is a 0.3% 30-day overall bariatric mortality rate. 4.1% of patients have serious complications, especially if you have a very high BMI, so BMI over 40 at least, extreme obstructive sleep apnea, the inability to walk 200 feet, and a history of blood clots in the legs. The experience of the surgeon and the surgical center are predictors of safety. Midterm and longer-term complications include intestinal obstruction, marginal ulcers, ventral hernias, gallstones, kidney stones, osteoporosis, and hypoglycemia. You also have mineral and vitamin deficiencies, which include iron, calcium, vitamin D, B12, copper, and thiamine. So these patients will need to take a multivitamin every single day for the rest of their lives. In summary, the following is associated with long-term success in weight loss. Frequent self-monitoring, so you want to weigh yourself and have a food diary. You want to stop snacking, and that includes eating while watching TV or a movie. You want to limit your refined carbohydrates, which would include white bread, white rice, certain cereals, muffins, donuts, chips, cake, cookies. Don't drink beverages that have a lot of calories in there, like boba, soda, juice, alcohol. Don't eat late at night. Get enough sleep. Try intermittent fasting. You want to increase your physical activity. In terms of which type of physical activity, try the high-intensity interval training. You want to eat at home more often because the outside food tends to be higher in portions, higher in calories, higher in oil, and higher in salt. And you want to reduce your screen time. If diet and exercise do not work, there are medications and bariatric surgery. You will have to discuss this with your primary care provider. Okay, thank you for your attention.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.